Good morning, everyone, and thank you all for coming here at Choosewell for our weekly press conference where we talk about a lot of great things that are happening throughout our entire city, and which we certainly have a lot of great things to talk about today, and also any other topics of the news that are there. We're going to first talk about some things as to why we're here related to this. I'll then speak about some other things that are happening in our city towards the tail end, and of course take any questions from the media at the end as well. But this is wonderful to be here today. Today we are at Choosewell Communities, a great partner to our city that helps families succeed, helps families in recovery succeed so that they can thrive. I'd like to first introduce you to, before we get started on some of the great news, I'd like to introduce you to the leader of Choosewell Communities, and that is Leanne Yost. Leanne, thank you so much. Thank you so much for hosting us here today. And please tell us a little bit more about all the great work Choosewell does.
Absolutely. Thank you all so much for coming. And I want to say a big congratulations to everyone here. We all worked really hard for this money, didn't we? Yeah. Yes, we did. We want to also thank Choosewell, Sanctuary Church. Sorry, I'm nervous. Sanctuary Church for hosting this, as well as Choosewell Communities. We do have our offices here. Our mission is to faithfully accompany parents suffering from substance use disorders and that have children under 5. Our vision is that every child in Metro Louisville grow up in a safe and nurturing environment free from substance use and child abuse. 2 statistics that unfortunately Kentucky is a little bit known for. We recognize the importance of addressing the social stigma surrounding substance use disorders, and we provide a supportive environment for rebuilding relationships and resources. It's an unfortunate reality, but everyone here today is touched by someone with substance use disorders. Everyone, be your mother, brother, sister, cousin, neighbor. Breaking cycles of generational trauma is not for the faint of heart, as everyone in here knows. Everyone working in the trenches knows this. Under the easiest circumstances, substance use disorders are incredibly difficult to overcome. This is where Choosewell Communities comes in, and all of the other organizations that are here. Research affirms that children living in safe and healthy, socially connected home environments realize more favorable outcomes with physical and social emotional health and learning readiness than their peers whose lives have been challenged by early childhood adversity, known as ACEs, adverse childhood events. For the past 10 years, we've journeyed with families as they secure suitable permanent housing, participate in recovery-focused coaching and support, learn strategies to participate in experiences that result in reunification with their children, and safe and healthy drug-free homes to dramatically improve odds of long-term sobriety. We've honored over 40 graduates from 4 classes, all of whom have worked very, very hard to complete the Choosewell program and retain long-term sobriety, one of who you will hear from later today. Thank you for your time. Thank you for being here. I'd like to bring the mayor back up.
Thank you so much. Thank you so much, Leanne, to you and all your colleagues for the wonderful life-saving and life-supporting work that you do for all of your clients here at Choosewell and that you offer to families across our entire city. Today we're here to announce some big news that will help with one of our overarching efforts and the efforts of so many organizations and people around the country, and that involves addiction. As many of you know, Kentucky has secured approximately $900 million in opioid settlement funding since 2021. The settlement provides guidance that the funds should be used on evidence-based strategies that address opioid prevention, treatment, and recovery, and so many other aspects of the negative impacts that opioids have had on our city in the past and that we're still dealing with today. Over the course of 18 years, Kentucky's share of these funds will be distributed throughout the state, with 50% of the total state funds going to local governments, including right here in Louisville and Jefferson County. So far, Louisville has received $7.2 million from the opioid settlement funds in the first 2 years, and we're continuing to put these funds to use to invest in high-impact projects. The first round of funding, which was $2 million, was approved by Metro Council in August of 2023 and was focused on immediately saving lives. Before any settlement funds were distributed, our Public Health and Wellness Department conducted extensive research on evidence-based practices to prevent and decrease opioid use. Our team at the department also attended community listening sessions to hear what community partners and residents felt were important considerations and important solutions. Our community identified these priorities: saving lives, addiction prevention, support for treatment and recovery, and relief from homelessness, something that is far too often the result of addiction. And so today, I'm thrilled to join with friends across the community and organizations that are doing wonderful work to announce that we are recommending the distribution of $5 million to fund 21 projects that will make an impact, a huge impact, in the areas of prevention, treatment, recovery, and support for people who are homeless. These projects will engage more than 18,000 people across our city whose lives have been negatively impacted by opioid addiction. More than 8,700 individuals and families will receive treatment and recovery support. Nearly 1,500 unhoused community members will receive necessary services and assistance. And nearly 8,000 Louisvillians, primarily our youth, will receive addiction prevention support. These high-impact projects are being recommended after careful consideration and review by the Opioid Settlement Advisory Board that I appointed. I want to acknowledge all of those board members, many of whom are here with us today. The co-chairs were Dr. Inder Singhal, Interim Medical Director, who you'll hear from in a moment, and our Interim Chief Health Strategist, Connie Mendel. Nicole George, our amazing Deputy Mayor of Public Health and Services, is here, and she too was involved in this project. Philip Baker, representing Metro Council District Council 6, was involved, but he removed himself from much of the process because Metro Council ultimately has to approve all of these recommendations that we're making here today. Maria Laterman, who's the licensed clinical forensic psychologist and executive administrator chief psychologist at the Louisville Metro Department of Corrections, and she was representing the behavioral health community. Lee Zimmerman, the CEO of Kids Club, which is uniquely focused on the needs of children, youth, and family. Lee also has a really poignant and appropriate personal history and story that helped him bring a unique set of experiences to this group. Adria Johnson, president and CEO of Metro United Way, which is, among many other things, uniquely focused on building community resilience and addressing the root causes of substance abuse. Mariana Barzin, our executive director of our Office of Philanthropy. And Barry Allen, president and treasurer of the Geens Foundation, representing the philanthropic community who are doing so much to invest in organizations like these that are with us today and others across the community to support families in need that are in need because of the result of this crisis or other impacts that they have been dealing with.
Thank you, Mayor, and thank you all the organizations who filed the application. It is truly heartwarming to see so many great organizations, and this is an example here, Choose Well Communities, doing such great work and helping people overcome substance abuse, substance use, and live their best lives. So prior to issuing this request for application, Louisville Metro Health and Wellness consulted with community partners about their experiences navigating the process. And we heard a common theme, the complexity of the application process. Ms. Yost, I'm sorry to hear it was still complex. We thought we had tailored it down. So we thought that we had made the application process a little bit streamlined, and we helped all the applicants by providing them the evaluation criteria so they could file their application appropriately. A request for application was issued in October. Application process was closed on December 4th. So to be considered, the organizations had to provide services to people living in Jefferson County and Louisville, and the services had to fall in 3 different categories: prevention strategies and services, including primary youth prevention, treatment and long-term recovery and sport, housing and comprehensive wraparound services for people experiencing homelessness to support them in treatment and recovery. As Mayor mentioned just a few minutes ago, it's a vicious cycle. To be recommended, applicants had to offer competitive proposal that aligns with approved use for the settlement and the principle for use of funds from the opioid litigation published by Johns Hopkins Bloomberg School of Public Health. They had to be evidence-based or evidence-informed. They should include data that support the need for the project and a thorough project description, detailed information about population they will be serving, and particularly population in underserved areas. And that was very intentional on our part when we were reviewing these applications. The application should demonstrate the applicant's knowledge of the relationship with the population to be served by the project, demonstrate how the proposal aligns with local priorities and community-identified needs, metrics to gauge success, as well as plan for sustainability. In total, we received 60 applications from 58 organizations requesting more than $25 million. The board members reviewed these applications and scored these proposals that they closely align with our criteria. I want to echo Mayor's comments here earlier, thanking the Opioid Advisory Board and the Louisville Metro Health team. I know how much work that was going through those applications. So 21 projects from 20 organizations met the top priorities, and they were selected to be recommended for funding. The funding recommendation supports many local grassroots organizations doing great work in opioid abatement. So I want to emphasize the recommendations must be presented to and approved by Metro Council before any funding awards can be made. It is truly an honor to work alongside our community organizations who are doing meaningful work, profoundly impacting lives affected by opioid epidemic. These grants will help create change and healing within our community. I wanted to make it clear the opioid abatement funds are not a generous gift by any means by the manufacturers, the middle managers, or pharmacies. There is no amount of money that will ever reverse the loss of young lives and the damage to our communities. These settlement funds used with the help of great community partners here is a tiny step forward towards healing our communities. This will provide some vital resources for addiction treatment, recovery, prevention programs, but they will also help create a safer and more resilient environment where individuals can thrive free from the grip of addiction. Thank you. I'd like to invite Ms. Yost. Yeah, thank you.
Thank you again. I'm sure it was a lot of hard work because the applications were like 50 pages long or something, right? Thank you again for being here. Thank you to the mayor for having this press conference here. My favorite thing at Choosewell is to let our families shine. One of the things that we do here and we're able to do is hire some of our graduates. I'm the only non-graduate of Choosewell at our staff right now. And you see some graduates up here. We're going to hear from one of them right now, and she is our senior family recovery specialist. Her name is Lindsay Wood.
Thank you. I'm very nervous now that I'm actually here. It was okay when I was standing over there. So as they said, my name is Lindsay Wood. I'm a graduate of Choosewell Communities. I wasn't originally from Louisville. I made the decision to go to treatment, and when I had went to treatment, I had already had like 4 kids taken from social services. So when I found out I was pregnant, and I was continuing to use substances. That was my pattern. Thankfully, through some of our great partnerships that we have developed as a nonprofit, we take referrals from the larger treatment facilities. We've actually opened our pipeline to receive referrals from Isaiah Houses. Really anywhere that has an accredited ILP program, and thankfully through the money that we receive for this, it will allow us to continue to help more families. So I went to treatment. And one of the things that they offered in this treatment facility as their exit plan was Choose Well Communities. And so I'm from a small town. There are no resources. And I had made a decision at that time to get clean because I wanted to do something different. I didn't want to go back to prison. I didn't want to lose this child. And so I just followed the pathway. I did what was suggested. And it has been an amazing journey. When I tell you that because of the things that Choose Well provided to me, I was able to move to Louisville, start a new life. I have a degree now, which is crazy. Yeah. I got custody after 5 years of those kids being gone. I got custody of them back. Yeah. Let's see, I bought a house this year, which is crazy. Yeah, it's an amazing, because see, what Choose Well is it's a hand up, right? Like they're not looking for hands out. People, when you start from the bottom, you lose everything, and so it can be so hard and overwhelming when you feel like you're starting with nothing. You feel like the world is against you. So to have people, I want to thank the founders of Choose Well. They're back there in the back. They're not addicts. How crazy is it that people would love us, that would just be willing to step right into the problem, and I want to thank the mayor. I want to thank all of the different resources. I want to thank our community partners, Social Innovative Properties, where they give our people the opportunity. We are constantly struggling to find landlords for, there's a stigma with this Section 8. I want to thank Louisville Metro for just the opportunities that they give us, because it's really changing lives. As a mother of 4, I could have made it in Louisville, but we'd have been living in a 2-bedroom apartment. And I don't think that my life would look anything like it had I not had the appropriate steps that were given through all of the resources that this community has. So if you are a part of that, right, the resources and the opportunities that you all take to improve the quality in people's lives, I want to thank you.
Thank you.
Thank you so much, Lindsay, for sharing your amazing story. That is an inspiration to all of us here, and I hope others around our city. And thank you so much, Dr. Singal, for explaining the process. And I could not agree more with Dr. Singal that this is not a gift. This opioid crisis has impacted so many parts of our city in so many ways. And that's why over the coming years, you heard that these are funds that we're going to be getting over years to come. We will be doing different things each year to continue to invest in impacted areas of our communities that have been impacted by the opioid crisis and that have cost our city, our organizations, our people so much as a result of this deadly crisis. And before our friends from all these organizations depart, every week we recognize a Louisvillian who is doing good, who is doing great things for our community. And this week we'll close by someone who you've already heard from that's making a positive impact on our community. You just heard about some of the great work her organization is doing to help the lives directly of people who are impacted. This is truly life-changing work. And I know so many other organizations here with us today are doing similar life-changing work. So Leanne Yost, if you'll come back up. And
Wow.
thank you so much for the work that you're doing to help others who you come in contact, to help their families, and to help make our city safer, stronger, and healthier. I am honored to proclaim you as one of our many distinguished citizens for all of the work you and Choosewell community does. Congratulations. Thank you so much.
Thank you so much.
Thanks, Rachel. Okay. And thank you so much to all of the amazing 20 organizations that are the recipients of these opioid settlement funds. You all deserve it, and we look forward to all of the great work that you all continue to do. Thank you so much for joining us here today. Thank you, guys. Excellent. This week is Telecommunicators Week, and we all know we've seen so many of the great first response efforts that so many of our emergency responders have provided. This year, we're talking about a couple of anniversaries. We all remember the response from LMPD to Old National Bank shooting. You saw the officers that were involved in that. Just a month or so ago, we saw the responses from our local fire department and the response that they had to a crisis on the bridge across to Indiana to rescue and save a life. And whether it's situations that require, like those that we see on the news, or ones that happen every day in our city, whether it's situations that require police, fire, emergency medical services, our public safety telecommunicators are the vital link that are working behind the scenes, ensuring that our first responders get the call, make it to the call, and have as much information as they need to assist when they arrive on the scene of an emergency. From the Clark Memorial Bridge rescue to the mass shooting at Old National Bank 1 year ago, our telecommunicators continue to show us the essential role that they play in keeping our community safe. You often never see these individuals. You occasionally hear them when you hear the 911 tapes of their great professionalism. So this week, I am so proud to recognize these heroes by proclaiming April 15th to 20th as Public Safety Telecommunicators Week. And this is a time where we recognize and honor the women and men of MetroSafe 911 who respond to emergency calls, dispatch emergency professionals, and help render life-saving equipment. So I'm so proud. Where is Dispatcher Emily David? Oh, there you are, Emily. I'm sorry, I didn't see that. Come on up. Emily was working on the morning of April 10th when 911 first started getting the calls about the Old National Bank shooting. Her courage, her dedication, her composure, her professionalism, her care for others helped our community, helped the other first responders ensure that lives were truly saved that day. So Emily, on behalf of our entire city, again, we are proclaiming this week Public Safety Telecommunicators Week. Thank you so much to you and all of your colleagues that do such important work to keep our city safe. Thank you.
Thank you so much for having me here today. My name is Emily David, and I am a public safety communications specialist with Louisville MetroSafe for the last 17 years. And this week is National Public Safety Telecommunicators Week, which is always the second week in April. You may be familiar with some of the amazing work of our telecommunicators, even though we're never seen. Incidents like the 2nd Street Bridge accident, where my colleague, Deanna Wetter, got the run and thought, is this really happening? But it did not delay her in getting the correct personnel and equipment on scene to make that amazing rescue. We're familiar with these kinds of unthinkable stories, and that incident took a total of 7 dispatchers and 7 call takers, so it's always about teamwork. Well, also, you maybe think of the recent weather event in the East End. We took over 300 calls in an hour and 15 minutes, and 104 of those were 911 calls that were answered within 15 seconds or less, which is an amazing statistic considering the kind of surge of calls that a large-scale event like that brings about. But we handled that seamlessly during a shift change. You've also maybe heard us call the first responders, and that was never more true when my colleague, Dana Frost, answered a call from a victim inside of Old National Bank. She was the first person on scene present with anyone inside the bank. But she stayed calm and she reassured the caller until the police could be with her. These are only a few newsworthy events that highlight the teamwork and the life-saving efforts that my colleagues put in every day. When you call 911 in the city of Louisville, you're not reaching some faraway call center. We are citizens of Louisville and the surrounding counties, and we care very deeply about the safety and the health of our city. I assure you that the employees of MetroSafe are some of the most well-trained and professional employees of the state in 911. Last year, we took 1.3 million calls for service. And to put that into perspective, the state of Kentucky took 2.5 million 911 calls. Collectively at MetroSafe, we have over 1,223 years of service with Louisville Metro government. That is a wealth of knowledge and experience in handling emergency situations. I am so proud of our hard work, our teamwork, our quality of service, especially when we are meeting people in very difficult situations, and we will most likely never ever know the outcome. So thank you so much for the recognition and for highlighting our MetroSafe responders during National Public Safety Telecommunicators Week. And thank you so much for having me here.
One other group of people that are amazing telecommunicators also support are those who are making the call themselves. And I know that from firsthand experience. Just over 2 years ago, on the scariest day of my life, just moments after an individual fired 6 gunshots at me from a very short distance, and I realized that I was fortunate enough to have survived. I was the one of 5 people in my campaign office that was nearest to a cell phone that had been strewn on the floor, and I dialed 911 asking for help. And it was that 911 call taker who helped me and my 4 other colleagues in that room, in the scariest moments of our lives, keep us calm and waiting until we were ultimately rescued by members of LMPD. So Emily, to you and all your colleagues, not just for keeping our entire city safe, for getting first responders to where they need to be in the rapid time that they do, but also for what you do to those who are making the call at a time that is incredibly scary, difficult, and challenging. Thank you and your colleagues very much. One item of news to just speak about before we go into taking any questions from the media is something that we spoke about yesterday. And that is the 2 transportation challenges that are facing our city right now. There are very significant transportation challenges facing TARC and very significant transportation challenges facing JCPS. Yesterday, the board of directors of TARC approved a budget that is a result of decisions made by prior leadership over many, many years, and the lack of a long-term plan have put TARC at the bridge of insolvency. They passed a budget yesterday that will keep TARC solvent, that will keep buses running, keep continuing to serve the folks in Louisville that depend most on public transportation to get to the grocery store, to get to work, to get to medical appointments, or our paratransit riders that depend on transportation for so many things. Unfortunately, that budget included a very difficult decision, which was that at least the short-term impact will be that not as many TARC bus drivers are needed for the routes. And it's impacting hardworking men and women of TARC that are serving our community, that are true public servants. At the same time as TARC is dealing with this transportation challenge, there's another transportation challenge that I know all of you know about well, and that's with JCPS. JCPS is in need of more bus drivers to fill their 575 routes that they have every day to get our JCPS school kids to school on time and then back home safely and on time. On any given day, they are roughly 75 drivers short, approximately 500 drivers for 575 routes. That is a large part of the cause of what JCPS has been struggling with this year. And so given the challenge that both organizations are dealing with, and giving my administration and my desire to help support the impacted truck drivers as much as possible, I believe there's an opportunity here, an opportunity to ensure that all the truck drivers continue to help serve our community in a very important way, to maintain a good paying job, and at the same time help all of our JCPS students and families address the challenge that JCPS is struggling with. And so that's why yesterday I called for a meeting with JCPS leadership, TARC leadership, the union leadership for both TARC drivers and bus drivers, and other community members, Metro Council leadership as well, to all get together to see if we can make this a reality, if we can turn challenges into solutions. That's exactly what I'm hoping that we can do. It's too early to know whether this is the solution for JCPS or one of the solutions, but I'm hopeful that we can help address and face these challenges and turn them into solutions by working collaboratively, by working creatively, by working quickly. That's what we're about. That's what I will continue to be about as mayor, and I look forward to having this meeting in the coming days to start this work and to continue to listen to other ideas across the community to continue to support JCPS and the students and families that depend on JCPS every day. It is so important that we get our schools, that we get our kids to school so that they can have the highest possible quality learning experience every day of the school year. Happy to take any questions on that or anything else that the media would like to ask about. Thank you all very much.
Mayor, so last school year, it was a rocky start with transportation at JCPS. Do you have an idea of when the possible layoffs at TARC would happen, if they would get jobs at JCPS before the start of the school year this year?
So the budget that the TARC board approved yesterday would indicate that some of the layoffs would begin January 1st. That we would need to figure out a solution sooner so that we can help JCPS before the start of the next school year. So we are going to work, again, collaboratively and quickly and with great focus to help those organizations get together and lend any other support that we can to try to have a solution in place prior to the beginning of the school year. Any other questions on that or anything else?
Could you give an update on the city's strategy of purchasing abandoned homes in hopes of reselling them?
Yeah, sure. So we certainly have far too many vacant and abandoned properties across our entire city. And unfortunately, those are often in lower income communities where we need to do everything that we can to help lift those communities, to invest in communities that have been overlooked for generations. We also at the same time are looking to get more homes into the hands of families that can be homeowners. And so we are working with our housing and community development group to do everything we can. We're working on some new strategies, for example. One that we're working through right now that we're getting ready to roll out is that one of the challenges that these vacant and abandoned properties have is that there are often liens that are placed on the property because out-of-town owners or negligent landlords or other owners don't care for their properties when they become abandoned. And the weeds grow, the house, it becomes a danger to the entire neighborhood. And so liens are placed on the property. If there's someone who wants to come and buy that property and turn it into a new home ownership opportunity for a family, oftentimes the cost of paying off that lien is prohibitive, and so the house continues to sit there. We're working right now on a program that would waive these liens for anyone who's going to buy the house and either sell it to an income-eligible family or is going to rent it to an income-eligible family, so we can improve the quality of these vacant and abandoned houses and also give families opportunities to be homeowners. At the same time, this will help improve neighborhoods across the community. That is one of several things that we're working on to help get the nearly 500 units of vacant and abandoned properties that the city itself owns into new ownership hands to help improve neighborhoods.
And the city recently purchased a couple properties near Churchill Downs. Are those the same plans, or is there something different that you hope to use for those?
I'm not familiar with those exact two purchases, so I can't speak to that.
Could you circle back around to the settlement funding? How and why do you believe that this will save or change lives?
Opioids have done so much harm to our city, to other cities and towns, to our entire country. So these funds are well deserved by our community, and particularly for those individuals that have been impacted by addiction and the opioid crisis. The 20 organizations that received proposed funding today are doing great work to help those who have been impacted by addiction, to help them and their families have a new path on life, one that's free of addiction. As Dr. Single said, this is by no means a gift. This is simply a small payback for the negative impacts that opioids have had on our cities and others. And I believe it's very important to invest in organizations that are supporting and for us to be reimbursed for the cost of this opioid epidemic that we're dealing with. Anything else? All right, well, thank you all very much. And again, congratulations to all the organizations.